In front of me you can see 4 models of the same 2 lumbar vertebrae presented as textbook normal, phase 1, 2, and 3 of spinal degeneration, also known as osteoarthritis, osteo meaning bone, also known as degenerative disc disease, and also known as wear and tear. I like to call it osteoarthritis with my patients. I like to tell it as it is. So let's look at textbook normal. So here we have a normal lumbar segment, 2 vertebrae here, really healthy cartilage disc in between. If you look at the disc from the top side, you can see that the gelatinous or gel-like toothpaste substance is well contained in the cartilage rings of the disc, and that's what we like to see. From the back, we've got great bony alignment. The spinous processes are in a great line. These are the ones you can feel as you run your finger up your back. You can also have your chiropractor detect if you've got any early misalignments in rotation, side to side. Different kinds of movements there. That's easily detected and corrected. So from the side here you can see also very healthy nerve roots. Lots of space for them to communicate with the body, with your organs, your blood vessels and glands. So our nerve system runs our health. So we don't want any interference from misaligned or degenerated discs and bones. So that's textbook normal. After maybe a year or 2 of incorrect postures, and that can be from for a number of reasons, we may start to see some changes. We've got phase 1 of degeneration. Now we start to see the wear in the discs. They're dehydrating. On top, you can see that the rings of cartilage, they're starting to break up here, and the gelatinous center is starting to change as well. It's all getting rather dehydrated. There are no effects as yet, or mild effects to the nerve system, so to your health. These individuals may not present with health problems yet at this stage. They may have some mild symptoms. After about a decade of incorrect postures, poor lifestyle, number of factors, injuries, being super athletic, manual laboring job, we tend to see more people in phase 2 now of spinal degeneration. Very different to textbook normal. Look at the difference in the disc heights. We can see a very dehydrated disc here. Notice that the gelatinous middle, the toothpaste-like substance, has leaked through the layers, and from the side you can see that it's now bulging. This is known as a slipped disc or herniated disc, and now we're getting irritation. Look at the difference, the real choked nerve root here. And these nerves are the ones that run down the back of the leg. So these people often present with sciatica. Okay, they often also present with health troubles because remember, the nerve roots go to our organs, our blood vessels, and our glands. Really importantly is you'll notice these bone spurs here. As the bones have gotten closer together, the elements that hold them together, like the ligaments and the muscles, will become slack. You can't see them on this model, but there's so much movement in the segments, they've become unstable, and the body lays down more calcium to stabilize the segment. These are the people that are quite stiff in the mornings. And they're like, oh, it takes me a few hours to get going before I'm mobile again. After a couple of decades or more, 20, 30 years of incorrect postures, accidents, poor lifestyle, we see a lot more arthritis, osteoarthritis, wear and tear on this individual here. Look at the discs now. They've completely dried up, and what's happened between the bones now is total fusion. Not only is this person stiff, but their spinal segments no longer move independently with one another here. This person surprisingly often doesn't have pain as such, but they're extremely stiff. These phases 1, 2, and 3, by the way, can only be picked up by x-ray. So if someone's diagnosing you with wear and tear without an x-ray, at best it's a guess. Probably a good guess. You can really, if you've honed your skills as a practitioner, you can guess, but you'll never be able to guess if someone's phase 1, 2, or 3, which is why chiropractors use x-rays when necessary. Look at the dramatic effects to the nerves in phase 3, really choked nerves. You can be pretty sure this person has multiple health issues, because again, the nerves are feeding the blood vessels, organs, and glands, and they can no longer communicate optimally. A little like standing on a garden hose and hoping the water runs through. Well, it doesn't. So there you have it, your tutorial on slip discs. I hope that was really informative, and if you've got any questions, pop over to posturevideos.com and I'll answer them there. Thanks for watching.